We're pleased to welcome to this episode of Dairy Business Update, Dr. Brian Miller, Cattle Technical Services Veterinarian with Merck Animal Health. In his role at Merck, Dr. Miller provides technical support and consultative services and advice to dairy producers and veterinarians in Wisconsin, Minnesota, and other states located along the I-29 corridor. Before starting his industry career, Dr. Miller was a dairy veterinarian in Wisconsin for 20 years. Among his areas of expertise are mastitis control and prevention. Welcome, Dr. Miller.
Thank you, Joel, and thanks for having me today.
We know dairy producers are aware of the impact of mastitis on lost milk production, treatment costs, lower milk quality, but recently you issued a report talking about how mastitis infections can negatively impact reproduction. Mastitis infections in dry cows can negatively impact reproduction as well. Let's just talk about that for a minute.
Sure. So although a dairy cow can develop a new intermammary infection at any time during the lactational cycle, many people are surprised to learn that new intermammary infections are most commonly acquired during the dry period and not during lactation. So it's been estimated that over 50% of all environmental mastitis infections are acquired during the dry period that impact clinical and subclinical cases of mastitis in the first 100 days in milk. And also over 50% of the coliform infections are also acquired during that time frame that impact clinical mastitis cases as well in the first 100 days in milk. So how we manage the dry period is essential in terms of maximizing milk production, maximizing milk quality, and minimizing reproductive inefficiencies.
What are some of the practices that you recommend producers think about in terms of mastitis control?
So there are many preventative practices that we aim to put into the dry period to minimize new infection risk in order to maximize milk production, milk quality, and minimize reproductive inefficiencies post-calving. And this isn't an exhaustive list, but this is a list that several people, several mastitis experts, veterinarians, et cetera, consultants will recommend. So monitoring teat end condition. We want teat ends in good health, obviously, prior to going dry. Teats that are damaged have a greater risk of new infection. Utilize an internal teat sealant. Many high-producing cows today fail to form or have a delay in forming an adequate keratin plug. So an internal teat sealant helps prevent bacterial penetration of the streak canal. Consider using dry cow treatment with the advice and recommendation of your herd health veterinarian, either a blanket dry cow approach or a selective dry cow approach, again, based on discussions with your herd health veterinarian. One that's always key is to provide adequate bunk space or eating space to boost immune defenses, boost immune function. Making sure that the environment is clean, so sanitation and hygiene, reduce bacterial exposure to the teat ends, clean beds, clean alleys, clean walkways, etc. Make sure there's adequate ventilation and heat abatement. Consider the use of J5 gram-negative vaccines. These are vaccines that have been out for 30, 40 years. They reduce the incidence, severity, and duration of clinical coliform mastitis cases. These have a very high return on investment. And even though the dairy producer tends to remember the dead cow or the cow that they have to cull, the number one loss due to coliform mastitis is milk loss. So there's a very high return on investment with the use of these vaccines during the dry period and typically during lactation. And then finally, an age-old practice, but it's seldom utilized on every farm, is to practice partial insertion. When you're putting in mastitis or internal teat sealants, partial insertion minimizes new infection risk. And then another age-old practice is to clip and flame udders to remove unwanted hair that bacteria can cling to. So there are a number of different management things that experts recommend during the dry period. This is not an exhaustive list, but some of the things that are commonly done. And it really is about the environment that the cow goes into post-dry off that really dictates whether or not she's going to pick up new intermammary infections during this critical time frame.
And I take it that the stress caused by mastitis infection, as the cow completes her dry period, has her calf, and begins milking, and under normal circumstances would be ready for breedback a ways out. It's that stress that impacts her ability to conceive. Am I understanding that properly?
So actually, the mechanism by which mastitis negatively impacts fertility is unknown. It's debated. What they believe is that in response to mastitis, obviously there's inflammation, clinical mastitis, and cytokines, which are just chemical mediators that are released into the cow's body in response to that inflammation, trigger the release of prostaglandin F2 alpha from the uterus. And dairy producers know those things as like estromate, for example, or lutulized. Well, prostaglandin to a pregnant cow is a negative event. So prostaglandin released by the uterus kills the corpus luteum or CL, progesterone then drops, and as a result, the establishment of pregnancy is disrupted. So that is what they believe occurs. So then what this means to the dairyman is, how is it impacted? What does he see? How is it measured? Well, typically, if cases of clinical or subclinical mastitis occur during a defined breeding risk period, what shows up on the dairy in terms of negative impacts will be increased services per conception at first service, a reduction in pregnancy rate, an increase in days open, and if the cow is pregnant, increase in pregnancy losses. So when we put preventative programs in the dry period, not only does it help us maximize milk production and minimize losses in terms of milk quality, but you get a dual benefit. It also helps improve reproductive efficiency. So you get two bangs for the buck.
Well, I think that additional connection with reproduction caught my eye in your announcement, and we appreciate this explanation of what's going on here. Obviously, another reason to follow appropriate herd health practices.
There's a lot of press on milk quality and the impact it has on production, et cetera. That's been known for a long time. The impacts of reproduction have also been known for about 30 years, but it never gets the same amount of press. So I put this paper together with the help of a number of different colleagues and friends that I've met over the years in the dairy industry. And I'm just a messenger to all their good work that has been done over the last several decades.
Well, Dr. Miller, we appreciate you sharing these insights with us. Thanks very much for being with us today.
I appreciate the opportunity to be with you. Thanks so much, Joel.
We're speaking with Dr. Brian Miller of Merck Animal Health. You may contact him by email at brian.miller5@merck.com, or of course, consult with your own veterinarian. Thank you, Dr. Miller.
Thank you, Joel.
For Dairy Business Update, this is Joel Hastings with DairyBusiness.com.